At the outset, I am thankful to all of you to joining in. This is a podcast series. This is the sixth session of the podcast, which is a Gyan Pravaha. We have a two eminent guests for today. The first guest, all of us know about her, but to say a few lines about her is the true leadership is not about the power and the position. It's about the vision, inspiration, and unwavering the commitment to uplift the others while creating the lasting impact. And this is nothing than our president of Fogsi, Dr. Sunita Tandulwadkar. But if you are saying that the vision and leadership is a one name that comes into our mind is a madam herself, and the other perspectives of her that she is always uplift the others like me and make the history going on. She is the past president of IIG, that is the National Endoscopic Association of India. She is the president elect of the ISAR, and she is a founder president of Ovarian Regeneration Society. And she is the pioneer in the field of stem cell. And she is, to her credit, a research paper in which she has delivered the poor ovarian response patient with the help of the stem cell. And much more than that, she is belong to the city where I belong to, and we are really proud that she is the first iron lady from Pune who lead the organization which has more than 40,000 gynecologists. And second to our podcast is the guest. She is again the lady with the much more to her credit. She is belong to USA, but her own things come down to the India, and she is a professor clinical head from UCLA. She has passionate clinician and educator and a researcher. She belonged to India, but now after graduation from India, she has gone to US and pursue her future commitments in the field of medical science. She was a chair of a FIGO for chair of contraception committee, and now she will be the head of a division of the sexual and reproductive health and the rights at FIGO from 2025 to 2027. So before starting the podcast, I request our president, Dr. Sunita Madam, to say a few words.
Thank you. Thank you, Ashish. You are always very generous in introducing me. I really appreciate your sweet words spoken from the heart. Aparna, thank you so much for giving your valuable time to us. This podcast is the Gyan Pravah series, which comes live every night at 8 p.m. We have 30 committee chairperson, and every committee chairperson has been given one date. So if Ashish is on 6th, every month on 6th, it will be Dr. Ashish Kale. So today is our 9th episode, and it's becoming better and better every day. The viewership is increasing. It has become the talk of the country. Basically, I feel my 30 committee chairpersons are future leaders of Foxy. They have the capacity to become a vice president and president of the Foxy. So, what we need is giving them a platform, just ensuring that they fly with their leadership quality. When you have a podcast, when you have a dialogue with an individual, automatically your passion, your enthusiasm, your creativity, your oratory skill, everything comes together. And I feel instead of just having the webinars where I think the webinar no more in India at least were catching the viewership. It was just the continuation which is going on post COVID for last 5 years. And that's why this novel idea of Gyan Pravah came. And believe me, this is possible only because of my committee chairpersons. They are taking tremendous efforts and they are putting lot of time and energy in selecting the faculty, in creating in 40 minutes how they can be the best. It's like a director taking out the best from the speaker. And I'm sure, Ashish, with Aparna, your dialogue will go more than anyone can even think of. I wish you all the best. And I again thank Aparna for being with us, coming to India and doing this all is a wonderful thing. Thank you. Thank you. And
Thank you
to
so
the viewers, I want to say every day, 8 p.m., join Gyan Pravaha. Thank you.
Thank you. Thank you.
Hello friends, welcome to the podcast of the Fogsi, 8 p.m. today, and we have a special guest. I will introduce to all of you. She is the professor in OBGYN in California, USA. She is the ex-chair, you name it, there is the biggest organization of the OBGYN, that is FIGO, and now she is a director-elect for the sexual reproductive health. I think the name you may guess, it's Aparna, and I welcome you, Aparna, here.
Thank you so much, Dr. Ashish. It's my pleasure to be here.
It's always when I look after the Indians going to the US and marking their journey, maybe it's a political things, maybe it's any of the NASA or you name it, you have that Indian things there. So how you feel coming from the Indian origin and back into the US and having the professorship in OBGYN?
I think borders are blurred at this point in time. I feel very fortunate to have been brought up in India. I grew up in a small town, Mysore, which is in the southern parts of India, right? So I did my medical college over there. Then I had to immigrate to United States right after my medical college. I really, really wanted to do obstetrics and gynecology for my, for my post-graduation. So the journey in the United States was very, exciting, fulfilling. So the residency over there, I did it in Newark, New Jersey, which is on the east coast of the United States. So during the 4 years of obstetrics and gynecology journey, I explored all the different subspecialties. I looked into many different things. But one thing kept coming back to me, Ashish. It was that how can we prevent mothers from dying? How can we improve the quality of women, and their reproductive life? And when I keep thinking about the root cause of where we can prevent things, because once things happen, you can't change much.
Yeah, true.
So I think a wise person once said, prevention is better than cure. So I always wanted to see how can we prevent this? And everything, whether it's gynecological or obstetrics, was coming back to either preventing an unplanned pregnancy or taking care of the reproductive health in terms of like managing the menstrual health, managing like our day-to-day reproductive health, and everything kind of boiled down to contraception and sexual and reproductive rights.
Now asking you about that prevention and preventing aspects of it, how you focused yourself from your busy practice of OBGYN into the organization of FIGO, and that to be a contraceptive chair.
Yeah.
So it's a huge leap from the OBGYN because this is always when you talk about the family planning services.
Yeah.
It's a neglected subject though, but how you develop your interest into that?
Right. So I think it all started from my desire to either like prevent things from happening or like to kind of improve the quality of life of women. So as I was kind of looking into my future as to where I'm going to do my specialization or like where I'm going to put my academic efforts into it, because I knew I wanted to be in academic practice all along. So at that time in United States, this is about 15 years ago, there was a new fellowship that opened called Complex Family Planning. As I was exploring my obstetrics and gynecology residency, I wanted to see what are my options to pursue the next step of training. There was a lot of different subspecialties, but I think, as I said, prevention is better than cure. There was a new fellowship that had just come in the past couple of years, and that was called Complex Family Planning. Okay. It had contraception, abortion, sexual and reproductive rights. It had a little bit of global health component in it, advocacy, and like research. Everything that I wanted to do in my future, in my academic medicine, was in that. So my natural next step was to get into that fellowship, which I did in Los Angeles. That's what took me from, that was 2011 to 2013.
Okay.
And I graduated from UCLA Family Planning program at that time. Also during that time, I did my master's in public health. I felt like the public health lens to look at like the world in a little bit different way, again in the preventative aspect of it, was really important. So I did my master's in public health in community health sciences, in health education and health promotion for 2 years, along with my fellowship. So I graduated from my fellowship and my master's in public health, and I was given an opportunity to stay back as an academic faculty in UCLA.
Oh.
And I really, again, I think I always, both my parents are, professors. So I think the teaching is in my genes.
It's in blood.
So I always wanted to be in an, teaching institution.
Okay.
I also felt like that was my contribution to the next generation, was to prepare a set of doctors who are trained and sensitized to sexual and reproductive health. So that was my next step.
Just to ask you here, as you said, there is a genetic things in your as a professor.
Yeah.
So how you feel today's fellows under you? There is a
I have
change.
a lot of hope, Dr. Ashish. I feel like there is a lot
Yeah.
of goodness in the next generation.
Oh.
Obviously, they're different from our generation, but I do think, see, that's what in the last 10 years I've focused is how can we educate the next generation, not just the patients, but also the providers, right? Because everybody is changing. So over the course of last 10 years, I really kind of, my niche was, one was global health, because I belong to 2 different parts of the world. So to me, the borders are blurred. So I feel like I belong to like 2 different cultures. I belong to like, I have 2 different like places in me that I kind of belong to. So I really wanted to blur that. So global health was like a priority for me, and technology, because that's what kind of helped bridge like my connection to the world. Going from India to another country.
So
trying
how
to
we are
learn.
bridging on the podcast? So
Exactly.
though it's a different time zone.
So the technology and education, those were my niches. So I kept working on it. I got a grant from Bill and Gates Melinda Foundation.
Good.
I got a grant from Bill and Melinda Gates
Gates
Foundation early in my career, and I worked with one of a game developer to develop games on teaching sexual and reproductive health for adolescents. And we actually did that testing in India, in Mysore and Chennai, and we published that paper. Then I developed comics for contraception, because I felt like if you are talking to the younger generation, you need to talk in their language.
In their language.
So I got a grant from Society of Family Planning, so we developed that one. So the journey kept going, and there was global health, there was sexual reproductive health, and ACOG, the American College of Obstetricians and Gynecologists, had a global expert working group at that time. So that's what made me go into that as a, as an exploring young aspiring
so that opens the
OBGYN.
door to the organization of FIGO.
Yes.
So coming to you said the borders are breaking of blood now.
Yeah.
What I ask you, the 2 things, you come from the people now talk about the developing countries and developed countries.
Yeah.
So being a chair of a FIGO, what is your vision about the family planning services? Whether it should have something to do for the developing countries, and it is in the developed countries, their thought process, everything is different, or is the same?
I mean, so that's a great question, Ashish. What happened was, once I became the chair of the FIGO Contraception Committee, that was the first question I asked myself. Like, what is the contraception landscape that is there in the 139 member societies that FIGO actually has? I slowly started to explore, talking to different folks and understanding like how the challenges are. What was really interesting was that there was equal amount of challenges in the low middle income countries, and also very equal amount but different set of challenges when it came to the so-called developed countries as well. So at the end of my 2 years, I really felt like the biggest thing I could do was to explore in depth, like what were these challenges. So we actually got another grant from the Gates Foundation, like a smaller one, to explore what we called as contraception mapping project. In this one, we actually interviewed half of the FIGO member societies, almost 74, across the 5 regions of the FIGO. We asked them for experts in sexual reproductive health in each of the member societies. Sometimes this was like the president of the for example,
Societies,
Dr. Tang, who was the president at that point in time, interviewed for Fogsi. And there were a couple of other experts. So each region of the 5 regions, we did like interviews, and we tried to understand what are your projects, what do you want to do, where you want to collaborate. So we now have a paper that's actually coming up. We just put it for publication, and it has this wealth of kind of understanding. And the summary is that each one has a challenge, and there is tons of collaboration opportunities. And if we all work together, we can really make this world a better place for women.
Okay. Now I will ask you a personal thing.
Yeah.
You think see now you are heading such a busy organization, the world's biggest organization of OBGYN. So we know the baskets of contraception are expanding, and there is a newer modality of the treatments coming up. So do you think that the research is still there to have a much more things to expand?
Yeah. I mean, I think, when I was doing my fellowship, I actually went to the Population Council, which is in New York, to understand what it takes to bring a new contraception out in the market.
Yes.
That's when I realized it's not easy, right? Especially whether it's hormonal or non-hormonal. There is a lot of challenges that are involved in research, development, and bringing like a new thing into the market. So I think I see some of the new things coming up. I mean, there is like some of the newer hormonal kind of methods that are coming up, just to ease the use. For example, like there is a continuous like 1-year usage ring that came into the market not too long ago. There is drospirenone only. I know some parts of the world already have it, but it's coming up in like United States. And then there is like lot of newer things. There is like a gel contraception called Fogsi that came in the United States. So over the period of the last decade, I saw a lot of new things coming up. I also saw a lot of like older things which were there getting a little bit more popularity or a little bit more identity because of the expansion of the social media and like availability. Having said that, I do think there is 2 big portions. There is a lot of interest in non-hormonal methods, because I think social media is also polarizing the hormonal methods a little bit, one way or another. And there is also the hormonal methods gaining more and more traction because their non-contraceptive benefits, their ability to kind of help someone's life in other ways, not just preventing pregnancy, is also coming out like to be more like known to people. So I think the knowledge of contraception is kind of kindling some of the new things about the existing contraception, and I think the newer ones in the market are also slowly but surely making their way.
Baby steps.
There was also this Natural Cycles app, right? It is an app to track like the fertility and to prevent or to kind of get pregnant. So I think there is those things that are getting popular. So technology is getting popular. So
but now I'll ask you one thing. You're a woman. You're a woman of a substance. Now I can say I can listen to you and I can say that it's a woman of the substance. So if you are thinking it's a contraception is a right to the woman. So it's a right of her, and then it is a woman centric. It should be.
Yes.
We in India, now a populous country, we have a population which is growing ahead.
Yes.
And India government also doing everything what they can.
Definitely.
But always, when I go to any of the discussion, there is always a debate of a private sector versus a public sector. So as a FIGO chair, the ex-chair of the FIGO, what is your take on that? Really, it's so much of difference in over all the countries you visit, or it's a really a public sector is doing much more rather than the private sector?
But Ashish, I believe that the discussion should be more about focusing on planned versus unplanned pregnancy rather than the sector of private or public, right? I think shouldn't matter. It shouldn't matter whether someone is going to private sector or public sector. The one key question should be, are you planning to be pregnant? Is this in your next part of the thing? If they say yes, we are no one to talk about contraception, anything to them. I think everything lies in when you think about sexual reproductive health and rights in general, it's three things. Do you want to be pregnant? Answer is yes. Actually, can you get pregnant? If not, we need you to kind of help with the fertility services. And the answer is no, I don't want to be pregnant. Then the next question is, do you want something to prevent pregnancy, an unplanned pregnancy? Again, if it comes from them and if they are like motivated to prevent an unplanned pregnancy, I think only then we should give them more information. We should kind of give them all these choices and have them pick something that sits well with their life.
True.
I think the last thing we want is for people to feel like, women to feel like they're being coerced to use something to prevent, like, you know, an unplanned pregnancy. By no means that should be a coercion. So I think the question should be, you know, is this a planned
or
if the unplanned pregnancy is in the view, do they want to use birth control or not? If not, I think every medical student who is coming out of a medical education program should be equally equipped to learn fertility, like basics of fertility care, basics of contraception care, and basis of what happens if they get pregnant and, you know, they don't want it, or they're in danger to continue the pregnancy. Then basics of, like, you know, abortion services. I feel like those are the three pillars of sexual and reproductive health that every kind of medical trainee, definitely an OBGYN, you know, trainee should be kind of learned and like should be well versed in it. So I think that will be my kind of like aspiring goal, is to create something where I think every OBGYN who is coming out into the world, or every medical student who is coming out into the world, knows the basics of it. They don't have to do everything, but they know where to refer, they know what it is, right? I think that will change a whole lot of it.
Now I will ask you, in 2023, the Indian government come up with the implants, and we got our training for going back to the Kenya and doing the implant training. And Kenya in a family welfare, like family services, are much more ahead of India as compared to the implants and removal of the implants. So being the figure chair, do you think that Kenya and the African countries are much more equipped with the newer contraceptive options rather than we are taken into something from them?
Yeah, I mean, I think there is lots of different parts of the world are adapting different things in a different pace. So, I mean, I think it will be unfair to compare one country to another, because what happens in India may not happen in Kenya. The resources may be different. See, one of the other thing about like some of the hormonal contraception is that there are some of the side effects that may not sit well culturally. Like, you know, implants, one of the most common side effect is unscheduled bleeding.
Yes.
And if you are like in a culturally or religiously
in India it's a different
in a setting where abnormal bleeding is going to ruin your day-to-day life, it's not going to be popular here. Whereas in the United States, it is actually one of the popular method. But even with that, I actually tell my patients when I counsel them about it, I'm like, you may love it, you may hate it. You may love it for these reasons,
and you may have
you may hate it if these side effects were to happen. The bottom line is that I think what contraception method gets like a popularity or gets more like traction in a particular region is not
what are the 3 points where you thought there is an attraction for that particular method? What are those points?
The first and foremost, it needs to sit well with their general life and reproductive life. Right? For women, like the bleeding is like the scheduled bleeding, unscheduled bleeding, and also no bleeding. I think there are only 3 options, and that makes a huge difference when they take hormonal birth control. If you don't counsel them, you just give them a birth control, send them home, they're going to come back to you, or they're going to go on social media and say this is the worst contraception possible, right? The second thing is that it needs to be easier for them to use. For some, it might be just pop a pill, be done with it, versus some are very bad at taking things on a regular basis. So you may need some longer acting methods for those people. And actually, before all these things, the most important is the medical eligibility, right?
That's right.
Because
because we need to understand which suits the best.
Exactly.
But that has to be knowledgeable, and you need to talk to them.
So I think that is where we come into picture, and that's where I think Google's information or web-based information will be little bit more will be advanced, because we are going to be giving them what is safe first, and then look into what are their choices, how does this sit well with their life, and then kind of, navigating that.
Okay.
So the World Health Organization has this medical eligibility
Yes,
criteria.
true. Yeah.
They have amazing digital tools and everything. And having worked with World Health Organization in a, close and observing them up close as to how they work, they do an amazing job of like putting these resources out to
Self-care
everybody.
kit and everything they launched in India now.
Yeah, so I'm very grateful that organizations like WHO put out this information for providers, that we can interim, use that to safely prescribe birth control or like whatever it might be. So I
True.
think following those guidelines.
You talked about organization. Let me
Yes.
come down to the organizations of the different things.
Yeah.
We talked about WHO. Now we'll be talking about US FDA and USAID and Bill Gates Melinda Foundation. All these are donors. And do you, because you are the chair, you was the chair, and you have all the things in your arms, of how you look at them as a agencies and their working and their working patterns.
I mean, they all do a really excellent job, and I think every organization has their priorities. I've had wonderful opportunities to collaborate with organizations, all the ones that you mentioned, also the Family Planning 2030, which is another organization which is amazing. I think in my experience, I think it's really important when you work with an organization to understand what their priorities
True.
are, to kind of match to see what your priorities are, and to find that common path that kind of brings you both together, and have a goal that you say, okay, this is what we're going to work
Now
towards.
I'll ask you the personal question.
Yeah.
The personal question, we see Dr. Aparna Sridhar as a professor.
Yeah.
Then having the fellows, and after that ex-chair
Yeah.
of a FIGO committee chair,
Yeah.
now elect director of a sexual health. So what is the next I can look after?
I always work with like one goal in mind,
Yeah.
but my overarching, if you say my vision,
Yes.
is always to work to improve the health of women in this world. And I
that's-
think that is like an overarching vision that's
So
out there.
that makes your life started from where you are is in
Yeah.
in the medical school, and
Exactly.
now you are having the same goal again and again.
So that, Ashish, even today, I remember the postpartum unit of my medical college, where we used to counsel women about
Yeah.
contraception, and make them understand that yes, spacing the interval of pregnancy is important. And that is what is making me, every project that I do somehow translates to my basics, what I've seen in life, what I've experienced in life. So now I'm working on like emergency obstetric and newborn care, and how contraception is interspersed into it.
I had the opportunity to listen to your presentation of emergency
Yes.
outputs of it. But can I ask you
Yeah.
one thing? That's when you are happy
Uh-huh.
of delivering the babies, or talking to the audience of about the contraception, because being at the end we are a gynecologist, we are obstetrician. So what makes you more happy?
I think what makes me happy is a satisfied patient,
Yeah.
a satisfied
Absolutely.
medical student or
Yeah.
a trainee, and a satisfied audience who listens to me and says, oh, I learned something from it.
Yeah.
I think at the end of the day, whatever you do, it needs to have some sort of like an outcome that you can see. And if you can kind of see that outcome in front of your eyes, like, patients coming back, and even like I would have inserted an IUD and they come back in 2 months and they're like, oh, I'm happy. I know you told me about this side effect. This is happening to me.
Yeah.
And they verbalize the understanding of it. That makes me
That's
happy.
make-
A baby coming back and they bring their
Yeah,
child, and I
yeah,
deliver them. I
yeah.
still see them sometimes when they come back for their second, third pregnancies. That's the most like satisfying feeling, when you have a
True.
happy patient who kind of had the outcome that they wanted.
For the 40,000 gynecologists and more than that in a Fogsi,
Yeah.
I must say, when I wish to have this interview done, I have always has the figure in my mind. I'm talking to the figure chair, but honest to you, Aparna, whenever there is a hardly 2 years,
Yeah.
I am seeing you and I'm interacting with you. I never thought I'm talking to such a person in such a huge post, and what makes you, because I think you achieved everything, and you are going to achieve much more things in life. But what makes me comfortable is something different. That what's the magic you carry? I don't know,
I
but
think
it's
it's called content, Ashish. I feel like when you feel kind of happy about where you are in life, and you feel like, okay, I tried my best, this is what I can do, and this is where I am, I think.
Okay,
That
now
is kind of like
now to
being
we
in
coming
there.
to the last end of it.
Yeah.
Everyone is now talking about AI. Everyone is talking about
Yes.
AI. So what is your view of AI in contraception?
Yeah, I mean, I think a lot of potential. That's my one word for you. So AI can be, it's a broad terminology. There is a lot of use case for it.
Yeah.
From the tools such as helping the patients to make a decision, you could probably use it for a tool. For providers to kind of like use that and then kind of maybe come back with like input, like the safety
Yes.
questions into it, and then like something like that could be there. There could be access stuff that you can kind of look into. You can look at the trends in like what people are searching for, what's going on out there. I mean, the potential is like
Is
huge.
huge.
But also, I feel like we shouldn't forget that there is always a human component, because these services, whether it's contraception or sexual and reproductive health and rights, they're so sensitive. Something like AI
Absolutely.
can totally take a hallucination and take you in the other direction,
Absolutely,
right?
yeah.
Because it really, for example, you're a YouTube, like, if you're hooked onto the YouTube, you start looking at certain things. And depending on what you look at,
It comes to you.
right?
Back, front,
the
back,
more you
front,
look
yeah.
at something bad about a certain thing, it's going to
True.
give you more into that, because it thinks like AI has this potential for hallucinations.
Yes, true.
Which I think is could be a double-edged sword, right?
Oh,
Like, so
yeah.
every technology, to me, I always take a pause and say,
Let's
pause.
hit pause.
There is
Yeah.
positives,
Yeah.
there is negatives.
Negative.
Luckily for us OB-GYNs, I think there's still a hands-on component that hopefully
We
no
work on fingers and we are working on hands. Yeah.
can take off, or no robot can hopefully replace us.
Yeah.
But I do think we will be we'll be kind of like lying to ourselves if we say, oh, this
We
is
are
not going to
not,
go
yeah.
anywhere, because I think this is going to be a huge part of like our day-to-day life, at least in the next foreseeable future, and who knows what happens after that.
So, friends, here we listen to one of the expert in our community of the family planning services, and she talked to us about her views, about her journey, about the mind, what she looking at, about the AI, and certainly much more than that. I always look after her as my close friend.
Oh.
And I should be thankful to the Fogsi and president of the Fogsi, Dr. Sunita, for giving us a chance to interact with such a feminine and such a beautiful lady to start my podcast. Thank you,
Thanks
Aparna,
for your
being there.
compliments, Dr. Ashish. And also, I really want to thank Fogsi and Dr. Sunita for this opportunity. I really thoroughly enjoyed it, and I
Same here.
hope our listeners are also
Yes.
equally intrigued by our
Because
talk.
because this is the podcast where we have all the aspects of the individual.
Yes.
So